You get up and go and change the channel. But now you actually can sit there, use the remote to change the channel, use the elevator. There's really no exercise. Most people have become couch potatoes. The whole weekend they are lying there watching TV. So activity levels have reduced. Quick foods now, we're eating less organic foods, more processed foods. And then there's so much stress now. There's so much to do. I don't know if economic situations have made it quite stressful to get money. And so with all of that and lifestyle, I think it's become very common in young adults now, and that's a challenge.
Well, what is it actually, hypertension? If I come to you and say that, oh, would you say that I think you have hypertension? Is that what you would say?
So it depends.
Okay.
So we have BP levels we are looking at, your blood pressure levels we are looking at. So there are various categorizations, but the common one is the American Heart Association. So mostly if you are below 120, the top one, which is the systolic, it's below 120, and the down one, which is the diastolic, is below 80, then you are normal.
Okay.
But in Ghana here, we start really treating when your top one, that's your systolic, is above 140, and then your diastolic is above 90. So that's when mostly we start treating. But in other places, that would be regarded as stage 2 hypertension. But most of the time, we just watch you, and then we start treating when you're above 140 and then 90. So that's when we would tell you are hypertensive. But we don't just use one value to tell you are hypertensive. Of course, unless you have some risk factors. So if you have a family history of hypertension, then that means that even when you record that, there's already that history, or if you have some disease or other risk factors, which I'm sure we'll talk about later, then we won't take a lot of BP readings to decide or determine whether or not you're hypertensive.
Right.
But if you just walk in today and then your BP levels, so your blood pressure levels are high, we won't just use that to diagnose you. Because it could have been that day you were stressed out, like your mother was saying, Obama BP about means that you are stressing her out. So as soon as you stress her out, certain hormones are released, and the more stressed you are, the more likely it could lead to a high blood pressure. So we advise people to reduce stresses in life. And so that's really
what's really happening to the human body when the blood is high, or when the person has...
So this is quite technical, but there's so many things that can happen. So your heart is responsible for pumping blood to all parts of your body. So the first BP reading occurs when your heart contracts. The left ventricle contracts, it pumps blood. And then the second one is when it's relaxed. The lower one is when it relaxes. So if your arteries or your blood vessels are small, so it means that it's taking more efforts for pumping activity and to get to all parts of the body. And you see that your heart would be willing to do that work to ensure that all parts of your body are adequately served with enough blood. So that's where there's stress. So it virtually affects different parts of the body. It can affect the brain, it can affect your kidneys, it can affect your heart, it can affect your arteries as well, because then you need blood circulation to all these parts. And that's why hypertension is linked with a lot of other diseases as well. Yes.
Okay. So physically, if I'm not in the hospital and they're doing that, what can I do to tell? Is it that I can't breathe well? Is it that I feel tired?
So that's the scary part. Most people have no symptoms at all. Most people, unfortunately, most people's first time of finding out they have hypertension is when they have a stroke, or when they have what we call TIA. That's like a transient stroke. So you see that there's a deviation on the mouth. They feel there's one weakness, a weakness on one side. They rush to the hospital. We take care of them. They are done. Yes, or maybe they have a kidney problem, so they have a distended abdomen, their feet are swollen, their legs are swollen. So most people, the first time they actually find out they're hypertensive is when they have a heart attack, is when the actual, when there's a complication, that's when they find out they are. Okay. But then in rare cases, you can have terrible headache. So the terrible headache, unresolved pain medication, pushes you to the clinic. You come, we check your BP readings, and then we find out that it's high. Some people bleed from their nose, what we call epistaxis. So you can see that you're having nosebleeds. You come, we check your BP, and then it's high.
Why?
Some people to have breathlessness.
Coming out of your nose?
Yes, so it's because it has to deal with vessels. Sometimes it's a way of letting you know that your vessels have been affected. And then it's one of the signs that some people who have hypertension exhibit. So most of the time, there are really no symptoms at all. And that's why it's important to know maybe what the risk factors are. And then it's important to do things to try and then prevent yourself from getting the complications.
I mean, you started in your earlier, you started with the stress and some of the factors. So let's just go into it.
Okay, so family history is very important. If your mother has hypertension or your father has hypertension, then you're at risk of hypertension. Yes, but sometimes you don't know. So mostly when you come, we ask you what killed your mother, what killed your father. If your father died of a stroke or any of those complications, then we tell you that there's a possibility that you may be hypertensive. And that's why we are not too happy when people say, as for me, I don't fall sick. I don't come to the hospital. How would you know if there's something wrong with you? So we advise that at least once or twice every year, come to the hospital, just have your BP checked, random screening. That way, if there's something wrong, we'll be able to tell. Now, obesity. We know that obesity is linked to a lot of things, unfortunately. It has been one of the risk factors of hypertension. So we advise that you remain within the right weight. You should know what your height is and then the weight that is required. Or you can just go to the hospital, we check your BMI and tell you the levels that are good for you. And why, when you have hypertension, we advise you about lifestyle is because it's also linked to lifestyle. So your alcohol intake is very important. You shouldn't be taking a lot of alcohol.
How much is a lot of alcohol?
So that's the question. So you ask somebody, how much is a lot of alcohol? And they say they take alcohol once in a while when they go for events. You probe further and you find out that every Saturday they're at an event. So, or the person says that, oh, I take it once a month, but the quantity or the concentration of alcohol that person is taking once a month, they are better off taking it as much as the person who takes it every weekend.
Let's stay on the alcohol. So if I pick this bottle of alcohol and it says that 40%, and I take a glass and I pour myself, is the 40% in how much I have poured in the glass, or that 40% is in the whole of that the bottle?
So if you pour this out, it is still 40%. You're taking 40% of the alcohol.
If I dilute one
so that's
bottle,
a funny thing, but you're still taking 40%.
it's still 40. Even if you pour it in apple juice, one box of apple juice, it is still 40%. I'm asking for you, okay? I want us to have a middle ground.
So I'm happy. No, I'm just happy because this is what you find people trying to find ways and means of beating it. Like somebody will say, I don't drink alcohol a lot, just once in a while. But they're taking 70% or 50% at one sitting.
Okay,
and it's so much. Haven't you taken the 40% inside your body? You have. You understand? So it's like taking Coke with 16, or a fizzy drink with 16 cubes of sugar, and telling me that because you didn't take anything else, you haven't taken the 16 cube. You have taken the 16 cube. Even if you drink gallons of water, you still have taken the 16 cubes of sugar.
Honestly, I was trying to find a way around it, but...
Yeah, so aside that, to your diet is very important. We need to do a lot of fruits and vegetables. Yes, they really help. There are some foods that really help in relaxing the arteries. I told you, garlic has been known to be a very good one. Then there are onions as well. And then we have spinach, contomere, broccoli, salads. They really help. So green leafy vegetables really help as well. So fruits and vegetables really help. And then another risk factor is increasing age. Interestingly, it's higher. Studies show that it's higher in men till 64, and then after 64, it becomes higher in women.
Oh, I see.
So yes, but increasing age has been a risk factor for. That's why you see the older people, mostly when they grow old and they find out that they are hypertensive. But all these things, I'm talking about the primary hypertension, what we call primary hypertension, where mostly these are the risk factors. There are other causes of hypertension as well. So you may have a kidney problem, and then you can have hypertension from it.
Is it that the kidney triggered the hypertension, or you already had the hypertension?
So it's both ways. Certain kidney problems can lead to hypertension, and then hypertension can also lead to certain kidney problems. There are so many things that can affect the kidney. So yes, and then some people can have heart problems as well. Mostly it's a complication of the hypertension. Then those who take illicit drugs, so you're taking cocaine in some of these drugs, they've been known to be linked to hypertension. All of this is because of some of the hormones they release, and then they put unnecessary stress on the body as well. Then there are certain medications that we give you that may make you at risk of hypertension, but even with that, we tell you that this and this could be the cause or the risk factor, and then
And
you
it doesn't
can alter
stay with
it.
you forever, or it's as long as you're taking the medicine, it just might put you at risk to hypertension. But when you stop, does it
Yeah,
stop?
so those medicines we give you for periods. We're not
Okay.
giving you forever.
Okay.
So we give you for periods. And that's why sometimes when you go to the hospital, the doctor would be asking you certain questions. Do you react to this drug? You know, we ask you certain questions to know which ones to treat you with.
Okay.
And so if we find out that no, you already are predisposed to hypertension and there's a drug that could lead to hypertension, we just stay away from
Okay.
it. Yes, but
I've
this
heard-
is just for general knowledge. Yes.
Okay, I've heard women say that I never had hypertension, but since after my child,
Yes.
I have
Yes, yes,
okay,
yes.
why?
It's also a secondary cause of hypertension, and then even those with thyroid problems as well.
What's
So
that?
for hypertension, thyroid like goiter.
Oh, that one.
Yes, yes.
Okay.
So pregnancy comes with a lot of diseases. It leads to a lot of release of hormones and so many hormonal changes. And actually, it's a stress to the body. So all of a sudden, the body sees that there's new something in, and it has to try and fight it. Like, what is this? What's going on? So it's trying to fight it. Then there's a hormonal release, and that's what leads to all the sickness and everything you're feeling, because your body is trying to adjust to this new inhabitant, whatever.
Yeah.
Yes, and so most people, when they are pregnant, they can't get hypertension, they can't get diabetes, they can even have mental challenges as well. For some people, if they were never predisposed or they never had any risk factor, then it leaves.
Okay.
But for some people, it stays with them forever.
Okay.
So it's not the pregnancy that really caused it per se, it just triggered it or it brought it out early.
Okay.
Yes.
Okay.
So yes, pregnancy has been known to be one
Is there
of
any
them.
relationship between high blood sugar levels with high blood pressure as well?
Yes,
Diabetes.
Yes, yes, yes. So you find out that most people who are diabetic tend to become hypertensive as well. It has to do with the release of hormones as well.
Which one comes
So-
first?
So it depends. Some people get hypertension first. Some people get diabetes first.
Oh,
It's-
wow.
Yes, and that's also because both of these diseases affect the kidneys, and we know that the kidneys and their relation to hypertension. So yes.
Okay. How fatal is this?
So when you talk, well, I think that hypertension is not as bad if it's well managed.
Okay.
Yes. So the challenge is that most people don't take their medication, because every day having to take a medication becomes like a problem to some people. So most people don't take their medication, and that's when the complications set in. So that's when you can get a stroke. That's when you can get kidney problems. And you know that once the kidneys are affected, it's going to affect most parts of your body as well. That's when you can get heart failure, or that's when you can get heart attack, you see. And so it's because people don't manage their hypertension well that it leads to the complication. But we've had people who have taken medications for 30 years, 40 years, and they are living well
So every day,
every day,
every day.
every day.
I see this because my dad, like, he takes
Every
it. It's
day.
every day.
Yes, it's
What-
every day.
If you miss it a day or two, you don't know what heck can happen.
No, but if you miss a day or two, your body compensates for these things. You know,
Okay.
before you actually see complications of a disease, it means your body has been trying to fight it for a while.
Okay.
So if you miss it a day or two, unless your BP is so terrible, it mostly won't do much. And that's why a lot of people are not compliant with the medication, because if they miss it a week, they find themselves, oh, I'm fine, nothing is happening to me. You see, but it's just one day, you don't know, you go to work, you don't know who stressed you out, push your cortisol levels so
that?
high, it's a hormone, push it so high, sorry, push it so high, and then it can trigger, you know, so that's really it.
And so if it's not the secondary type, is it likely to be cured?
No, we manage hypertension, we don't
Like
cure
cure
it.
it.
Yes, that's why you take the medicine every day.
Even with the secondary one?
Yes, we manage it. We give you medications, so we manage it, yes. So that's why I'm saying that if it's from pregnancy, if after the pregnancy your BP levels go down, then you'd have to stop. We will make you stop taking the medicine. But I didn't want to delve there because most people check their BPs, and once they check their BPs and it's normal for a few days, they stop taking the medicines. No, we
Okay.
don't do that. We taper down the medicines. So if today your BP levels are low, maybe for a week, you've noticed that your BP levels are low, you come to us. We give you what we call a BP profile. So you check your BP maybe every morning and evening for a period. If we get normal readings, then we are sure that let's reduce. So if you're taking 10, let's reduce it to 5 to be sure that you are okay.
Okay.
Then if we reduce it to 5 and still you are getting very low BPs, then we are confident that we can let you go without them. But most people go home and then they stop the medications on their own. And of course, for a while, your BP will be recording normal values because like I told you, the body tries to compensate. It tries to help itself. So you'll be there thinking, oh, my BP levels are now normal. I can take the medicine. No. It's because your body is trying to remain stable till it gets help. Yes.
Yeah. Okay.
But one time, if it's not able to, then it just gives up. And that's why you see that there are certain people, all their diseases seem to come at one time. It's because their body has been trying to compensate and fight. And now everything has just given up. And then all their diseases come at once. Yeah.
Okay. Maybe my final question will be, some other medications, even as it's treating what the doctor hopes is treating, then it's causing you some problems as well. For BP medications that a person would have to be on it forever, at least, as long as I know and learning, and I'm learning from you now, it doesn't affect the human body in any way.
So, yeah, I get this question a lot. There are certain known side effects, especially with the men, that affects their ability to be consistent with it. So some of them, it gives them erectile dysfunction, or it reduces their libido and their performance.
Even in young adults as well? Or is this for the older? Okay.
Yes. So what we do is that we support you. We support you with medications that rectify the problem.
Okay.
Yes. So you need to tell us, don't stop taking the medicine. You need to tell us. Also, we can change the drug for you. There are drugs that certain people react to that others don't. So that is why you don't have to go and take your friend's BP medicine because it is individualized care. There are lots of things we look at and we give you the medicine. So somebody may be on 3 BP medications. You will just need 1 to work for you. And so we weigh the benefits over the risk. In every medicine that we give as health workers, we always weigh the benefits over the risk. We are looking at are these more beneficial than they are risky? And then we support you with other medications to bring down the side effects, or we ultimately change them. And also when you are a BP patient or you have hypertension, what we do is that mostly 3 to 6 months, or at least once every year, we do a profile of your chemistry. So we'll check your kidneys, your liver, we do a whole, and your cholesterol levels as well, to be able to compare with it. And that's why you need to constantly come to the hospital, because we need to monitor you. So mostly we do 3 months just so that we can monitor you, your progress, the medication you are taking. You let us know the side effects, and then we know how best to help you. Yes.
Okay. Okay. I guess you've been learning a thing or two, but let me just give you the rest of the seconds to just say everything, wrap it all up. What should be the take-home message at least? Yeah.
So the take-home message is, don't be at home and excited and be saying that, oh, as for me, I don't go to the hospital because I don't fall sick. It's not something to be extremely excited or proud about, because you don't know whether you're sick or not. So come to the hospital at least every year, or at least every 2 years. Make sure you come to the hospital. Run a full lab. You come to the hospital and tell the doctors you want to check your kidneys, your liver, your cholesterol, your whole body. We'll run labs for you, be able to tell when there's a problem. And even when you come to the hospital, even if we don't do anything at all, we check your BP. And that's when we are able to know if there's a problem. Also, I think the one challenge with most of us Africans is that we don't know our family history of disease. We don't ask questions. Find out the diseases that run in your family so that you know that, okay, my grandmother died of hypertension or stroke. My mother has had a stroke before. You know you are the next in line. So then you do everything to try and prevent it. So knowing our family history is extremely important. And at least every year, try and visit the hospital, please. Don't wait till it's too late. Otherwise, when you come, there's not much we can do. And also, before you stop any BP medication, please come to the hospital and let's decide that it's time for you to stop. Yes.
Thank you so much, Dr. Hannah Lisa, everybody's favorite doctor. Thank you so much for coming today. Shall we
Thank
give
you
you
for
a follow?
having me.
Shall we give you a follow on social media? Because we see you've been dishing out some small.
Oh, that would be great.
health
I mean,
tips.
if you follow me, you learn more. So I think
Right.
it's great. Yes. So you can
Okay.
follow me.
So it's at Dr. Hannah Lisa.
Yes, at Dr. Hannah Lisa on Instagram or Dr. Hannah Lisa Tete on Facebook. Yes. Yes. Yes.
Thank you so much.
You're
Guys,
welcome.
Throwback Thursday up next. Tego Sisters to stay.
Betway is your gateway to a theme park full of gaming excitement. A whirlpool of wonder where your favorite games come to life. Where